Hello friends, today I'm going to discuss what is dementia. Dementia is a general term for a decline in mental ability that is severe enough to interfere with your daily life. Alzheimer's is the most common type of dementia. Dementia is not a specific disease. It is an overall term that describes a group of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. Alzheimer's disease accounts for 60 to 80% of the cases. Vascular dementia, which occurs after a stroke, is the second most common dementia type, but there are other conditions that can cause symptoms of dementia, including some that are reversible, such as thyroid problems and vitamin deficiency. Now, what are the symptoms? While symptoms of dementia can vary greatly, at least two of the following core mental functions must be significantly impaired to be considered dementia: memory, communication and language, ability to focus and pay attention, reasoning and judgment, visual perception. Now, what are the causes? Dementia is caused by damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, thinking, behavior, and feelings can be affected. The brain has many distinct regions, each of which is responsible for different functions. For example, memory, judgment, and movement. When cells in a particular region are damaged, that region cannot carry out its function normally. Different types of dementia are associated with particular type of brain cell damage in particular regions of the brain. For example, in Alzheimer's disease, high level of certain proteins inside and outside brain cells make it hard for brain cells to stay healthy and to communicate with each other. The brain regions called the hippocampus, the center of learning and memory in the brain, and the brain cells in this region are often the first to be damaged. That's why memory loss is often one of the earliest symptoms of Alzheimer's disease. While most changes in the brain that causes dementia are permanent and worsen over time, thinking and memory problems caused by the following conditions may improve when the condition is treated or addressed. What are these conditions? Depression, medication side effects, excess use of alcohol, thyroid problems, and vitamin deficiencies. Now, what is the diagnosis? How can you diagnose? There is no one test to determine if someone has dementia. Doctors diagnose Alzheimer's and other types of dementia based on a careful medical history, a physical examination, laboratory tests, and characteristic changes in thinking, day to day function, and behavior associated with each type. Doctors can determine that a person has dementia with certainty, but it is difficult to determine that exact type of dementia because the symptoms and brain changes of different dementias can overlap. If this occurs, it becomes necessary to consult a specialist such as a neurologist or a geropsychologist. Coming to the treatment and care. Treatment of dementia depends on its cause. In the case of most progressive dementias, including Alzheimer's disease, there is no cure and no treatment that slows or stops its progression, but there are drug treatments that may temporarily remove symptoms. That's about dementia. If you have any doubts or queries, I request you to comment in the below mentioned comment box. If you like this video, kindly click on the like button and don't forget to subscribe to this channel for more updates. Thank you and have a nice day.